Our bodies are amazing machines, working hard every day to keep us healthy and strong. They are constantly performing countless functions, from pumping blood and digesting food, to fighting off infections and repairing tissues. Every breath we take, every step we make is a testament to the incredible capabilities of our bodies. However, despite their resilience and strength, our bodies are not invincible. But sometimes, our bodies get sick. Illness can strike at any time, disrupting our daily lives and making even the simplest tasks feel overwhelming. Whether it's a common cold that leaves us bedridden for a few days or a more serious condition that requires medical intervention, getting sick is a part of life that we all experience at some point. This is what we call an illness. Illnesses can manifest in various ways, affecting different parts of our bodies and causing a range of symptoms. Some illnesses are easily recognizable, like the flu or chickenpox, while others may be more elusive, requiring a doctor's expertise to diagnose. Illnesses can be mild or serious, short-lived or long-lasting. A mild illness might cause discomfort but generally allows us to continue with our daily activities, albeit at a slower pace. On the other hand, a serious illness can be debilitating, requiring extensive treatment and sometimes long-term care. The impact of an illness on our lives can vary greatly depending on its severity and duration. When we get sick, it's important to understand what's happening in our bodies. Knowledge is power, and being informed about our health can help us make better decisions about our care. Understanding the nature of our illness can guide us in seeking the appropriate treatment and support, whether it's over-the-counter medication for a cold, or a visit to a specialist for a more complex condition. Are we dealing with a passing cold or something more serious? Recognizing the signs and symptoms of different illnesses can help us determine the best course of action. For instance, a persistent cough and high fever might indicate a more serious respiratory infection that requires medical attention, while a runny nose and mild headache could be managed with rest and fluids at home. Knowing the difference between types of illnesses helps us get the right treatment and support. It also allows us to communicate more effectively with healthcare providers, ensuring that we receive the care we need. Additionally, understanding our illness can help us manage our expectations and plan for our recovery, whether it involves a few days of rest or a more extended period of treatment. This essay will explore two main categories of illnesses: chronic and acute. Chronic illnesses are long-term conditions that often require ongoing management and care, such as diabetes or heart disease. Acute illnesses, on the other hand, are typically short-term and may resolve with appropriate treatment, like a bacterial infection or a broken bone. We'll learn what these terms mean, how these illnesses affect our lives, and why it's important to understand the difference. By gaining a deeper understanding of chronic and acute illnesses, we can better navigate our health journeys and support those around us who may be dealing with these conditions. Knowledge empowers us to take control of our health and make informed decisions that promote well-being and quality of life. Chronic illnesses are health conditions that last for a long time, often for many years or even a lifetime. They can affect different parts of the body and may require ongoing medical care and management. Living with a chronic illness can bring unique challenges. It often involves making lifestyle adjustments, taking medications regularly, and attending doctor's appointments. Managing a chronic illness is an ongoing process. It's about learning to live well with the condition and finding ways to maintain a good quality of life. Chronic illnesses encompass a wide range of conditions. Some common examples include diabetes, a condition affecting blood sugar levels; heart disease, problems affecting the heart's function; asthma, a respiratory condition causing breathing difficulties; arthritis, joint inflammation causing pain and stiffness; cancer, uncontrolled growth of abnormal cells in the body. These are just a few examples, and many other conditions fall under the category of chronic illness. Unlike chronic illnesses, acute illnesses come on suddenly and last for a shorter period. They are often caused by infections, injuries, or other temporary health problems. While acute illnesses can be disruptive, they usually resolve within a few days or weeks with appropriate treatment and rest. Common examples of acute illnesses include the flu, a cold, a sprained ankle, or an ear infection. Section 5. Examples of acute illnesses. Common and less common. Acute illnesses vary in severity. They can range from minor inconveniences to serious health threats that require immediate medical intervention. Understanding the spectrum of these illnesses can help in recognizing symptoms early and seeking appropriate care. Some acute illnesses are mild and can be easily managed at home with rest and over-the-counter medications. For instance, a common cold might just need some bed rest, fluids, and perhaps a decongestant. However, other acute illnesses can be more severe and necessitate professional medical treatment. Here are some examples to illustrate the range of acute illnesses you might encounter. Common cold. This is a viral infection that primarily affects the upper respiratory tract. Symptoms include a runny nose, cough, sore throat, and sometimes a mild fever. It's usually self-limiting and resolves within a week or so. Influenza or the flu. Unlike the common cold, the flu is a more serious viral infection. It can cause high fever, body aches, severe fatigue, and respiratory symptoms. The flu can be particularly dangerous for young children, the elderly, and those with compromised immune systems. Vaccination is recommended to prevent severe cases. Food poisoning. This illness is caused by consuming contaminated food or beverages. Symptoms can include nausea, vomiting, diarrhea, and abdominal pain. While most cases resolve on their own, severe cases may require medical attention to prevent dehydration and other complications. Appendicitis. This is a condition characterized by the inflammation of the appendix. It typically presents with severe abdominal pain, often starting around the navel and then shifting to the lower right abdomen. Appendicitis is a medical emergency that usually requires surgical removal of the appendix to prevent rupture and subsequent complications. While most acute illnesses resolve without long-term effects, some can lead to complications or require a longer recovery period. It's important to monitor symptoms and seek medical advice if an illness seems to be worsening or not improving as expected. Early intervention can often prevent more serious outcomes and ensure a quicker return to health. Section 6. Treatment approaches. Chronic versus acute care. The treatment for chronic and acute illnesses differs significantly. Chronic illness treatment focuses on long-term management including medication, lifestyle changes, and therapies to control symptoms and prevent complications. Acute illness treatment, on the other hand, aims to address the immediate symptoms and the underlying cause of the illness. This may involve medications, rest, fluids, or in some cases, surgery. Understanding these differences is crucial for receiving appropriate medical care. Section 7. Impact on daily life. Adapting to illness. Both chronic and acute illnesses can impact daily life, but the nature and duration of the impact vary. Chronic illnesses, such as diabetes or arthritis, often require long-term management and can lead to significant lifestyle changes. These conditions may necessitate regular medical appointments, ongoing medication, and consistent monitoring of symptoms. Chronic illnesses may require ongoing adjustments to daily routines, work schedules, and social activities. For instance, someone with a chronic illness might need to incorporate regular exercise, dietary changes, and stress management techniques into their daily life. They may also need to communicate with employers about flexible work arrangements or take time off for medical treatments. Individuals with chronic illnesses often learn to manage their condition while maintaining a fulfilling life. They might find new hobbies or activities that accommodate their health needs, such as low-impact sports, creative arts, or gardening. Support from family, friends, and healthcare professionals can play a crucial role in helping them adapt and thrive. Acute illnesses typically cause a temporary disruption to daily life. These illnesses, like the flu or a stomach virus, often come on suddenly and can be quite debilitating. During this time, individuals may need to rest, take medication, and avoid their usual activities to recover fully. Activities may need to be put on hold during the illness, but individuals can usually resume their normal routines after recovery. The recovery period can vary depending on the severity of the illness, but most people find that they can return to their daily lives with little to no long-term impact. Understanding the differences between chronic and acute illnesses can help individuals better prepare and adapt to the challenges they may face. Section 8. The importance of understanding the difference. Understanding the difference between chronic and acute illnesses is crucial for several reasons. First, it allows individuals to seek appropriate medical attention and receive timely treatment. Second, it helps individuals understand the nature of their illness and make informed decisions about their health. Third, it facilitates clear communication with healthcare providers, leading to better care coordination. Section 9. Conclusion: Navigating health challenges. Illnesses are a part of life. By understanding the differences between chronic and acute illnesses, we can better navigate these health challenges. Whether we're facing a short-term infection or managing a long-term condition, knowledge empowers us to take control of our health and seek the support we need. Remember, it's always important to consult with healthcare professionals for diagnosis and treatment of any illness.